Hello and welcome to the Microbiome Medics podcast. I'm Dr Shiv.
And I'm Dr Sheena Fraser, and we're your co-hosts.
We are both GPs and lifestyle medics with a shared passion for microbiome science, and we have spent the last 5 years deep diving into the world of the gut microbiome.
We've been analysing the evidence, appraising the studies, speaking to the experts, and writing the Gut Microbiome for Clinicians e-learning course for the BSLM Learning Academy.
We have discovered that the gut and other human microbiomes are pivotal to every aspect of your health and physiology, and the pillars of lifestyle medicine hold the key.
So in these Microbiome Medic podcasts, we'll be covering the basics, bringing you the latest research and talking to the experts on all matters microbiome.
We'll be translating the evidence and packaging it into actionable, bite-sized chunks so that you can harness the power of the microbiome to improve your own health and that of your patients. Hello and a very warm welcome to this month's Microbiome Medics podcast. I am Dr Shiv, and this episode we're continuing on our theme of cancer and the microbiome. Last episode we talked about cancer initiation and prevention. We're now going to move on to the gut microbiome's influence on cancer treatment and survivorship. So at the moment in the UK, cancer patients have a wide range of different cancer treatments available to them. Some of the things include surgery, chemotherapy, immunotherapy, radiotherapy, stem cell transplants, and various drugs and hormone blocking medications. But despite this, there's very little discussion around the gut microbiome and how it could influence patient responses and prognosis. So in this episode, we're going to consider the mechanisms by which the gut microbiome might influence cancer treatment and how we can use this knowledge to improve survivorship. As always, I'm joined by my microbiome buddy, Dr. Sheena Fraser, who's going to kick off the discussion. Are you there, Sheena?
Hi, Shiv. Yeah, I'm here. Lovely to be here today. How are you?
I am very good. I'm excited about this episode. There's lots of incredibly interesting and really mind-bogglingly complex sort of science here. So we'll see where this leads us.
Yeah, I know it is a bit mind-boggling at times, I have to say, but it is fascinating, and it has kept me really interested over the last few months, looking into this really interesting area of clinical work, and I guess cancer work really touches on all of us. We all know people that have had cancer, suffered from cancer, even died from cancer, and I guess we're all desperate to find a way of improving people's journey with this horrible disease. So in the last episode, we were looking at how cancer patients already have this sort of imbalanced and dysbiotic gut microbiome, and how that's going to be the key driver, one of the key drivers in their cancer development. But the problem with this is it means they're starting their cancer journey with quite an unbalanced gut microbiome. And that microbiome might be quite pro-inflammatory, in other words, encouraging inflammation, and you might have more harmful bacteria which encourage the release of toxins, and you may also have a leaky gut, which may leak bacteria into your bloodstream and create inflammation elsewhere in your body. And so there are lots of things with this unbalanced gut microbiome that might be actually hampering your cancer treatment. And it's not really surprising that some studies have revealed that the level of dysbiosis can actually predict your response to chemotherapy and immunotherapy, and actually also predict the level of toxicity of these treatments, so how much side effects and problems you're going to have with them. So this is pretty much compounded by the fact that loads of these drugs, including chemotherapy and immunotherapy, are actually quite damaging to the gut microbiome. And chemotherapy causes quite a significant loss of diversity and richness of species of beneficial microorganisms. And other treatments that we use for cancer can also damage the microbiome. So even antacids and anti-sickness medications can damage our gut microbiome and lead to the overgrowth of harmful bacteria. And antibiotics that we commonly use to treat infections in cancer patients, and some are even given prophylactically for patients undergoing cancer treatment, can also cause dysbiosis of the gut microbiome. So this can have an impact on the effectiveness of our cancer treatment, sadly. Also, it's worth being aware that that the drugs will have a varied response in every one of us, depending on the composition of our gut microbiome. So some bacteria can enhance the effect of drugs, whilst others can inhibit their effect. And that's why people have such varied response to drugs in general. And it's no different for cancer drugs. Some patients will respond really well and others won't. And in many cancers, including breast cancer, pancreatic, prostate, and colorectal, an unhealthy looking gut microbiome associated with a high fat, high sugar diet, like the Western diet, is associated with that poor, unhealthy looking gut microbiome, which responds very poorly to treatment. So there was one study called The Relationship Between the Gut Microbiome and Systemic Chemotherapy. It was published by Samantha. It was written by Samantha Irvin et al. In 2020. And that actually stated that reduced bacterial diversity in the gut microbiome was associated with a 31% reduction in 3-year survival post-cancer treatment. And the authors went on to say that the gut microbiome defines the efficacy and toxicity of the chemotherapy. So it's not just chemotherapy that's impacted by the state of our gut microbiome. Immunotherapy is less effective for patients with melanoma and small cell lung cancer if they're lacking certain bacteria, for example, Akkermansia and Rhamnococcus. And studies have shown that where those bacteria are replaced prior to the immunotherapy, they've actually get a greater response to treatment. So it's really important to consider the health of the gut microbiome for the effectiveness of treatment and the side effects of treatment as well. So Shiv, I'm going to pass things over to you. You've been looking at the gut microbiome in patients with breast cancer. Do you want to talk us through the Oestrobolome for listeners who have never heard of this?
Yeah, well, if you haven't heard of it, you won't be alone. Most doctors and nurses won't have heard of it either. It's just to recap. So we have the gut microbiome. We know that's the trillions of microbes that reside in your gut. Now, some of these microbes actually are bacteria that can alter your estrogen levels. So these group of bacteria are known collectively as the Oestrobolome. So that's what that name means. Now, estrogens are sex hormones like androgens and progestogens, and they're derived from cholesterol. Now, estrogen levels are really important in hormone-sensitive cancers like prostate and breast cancer. So if we just for a moment focus on breast cancer, so this is the commonest cancer in women. So in the UK, for example, 1 in 7 females will be diagnosed with breast cancer in their lifetime. And this is kind of pretty staggering numbers. So about 385,000 new cases in the UK. That was, I think, in 2019, 160,000 deaths in 2019. So understandably, there's a huge amount of interest in preventing and treating this devastating disease. But although it is devastating, it's really important for us to remember that the majority of breast cancer patients now survive more than 5 years. And this is a new area in cancer care, this area of survivorship. So you don't just want to respond to cancer and get over it. You want to have a really excellent and healthy life afterwards. And we need to get ambitious for our patients. So things like good nutrition and physical activity and sleep and stress reduction and also the gut microbiome, these are things that they're all modifiable and they all influence our response to cancer therapy and what happens afterwards. So lessening adverse drug reactions, as you were talking about, reducing toxicity during therapy, improving our recovery, reducing breast cancer relapse, and also because we're all surviving longer after breast cancer, we don't want to then succumb to chronic disease. And so we want to be reducing our chance of chronic disease and increasing our lifespan and health span. So we really do need to move from survive to thrive. We want people to have, really healthy, flourishing life post-cancer diagnosis and treatment. So just this Oestrobolome, and estrogen is really important in breast cancer. It's important in every level, initiation, progression, metastasis. So this sex hormone, we always think about estrogen as being female, but it's important to remember it's present in men and women, and it's not a bad hormone. So things aren't good or bad in biology. It just depends what levels you have at what stage in your life. So estrogen is hugely beneficial and really important roles in sexual maturation, in fertility, but also in many other things. So bone, skin, memory, cognition. So our estrogen is made in ovaries and adrenal glands, but other sites you might not think about, so testes, and really importantly in adipose tissue as well. So these estrogen levels alter across our lifespan, and we need different levels for different stages of our life. So we want them to be high when we're maturing our sexual organs, and then we want them to go down after, towards the menopause. So the body carefully regulates our levels, and we make estrogen. It acts at all these different sites by binding specific estrogen receptors. And then what we don't need is metabolized, it's broken down and excreted, because we don't want lots of estrogen hanging around. We want the right amount. We don't want too much and we don't want too little. So about over 50% of estrogen is actually metabolized and conjugated in the liver and then excreted. But Sheena, I know that we've spoken before about, obesity and adipose tissue as being an important site of estrogen metabolism. But I didn't realise, I don't know if you did, that postmenopausally it can contribute your adipose tissue to up to 100% of your circulating estrogen levels. So did you know that? I wasn't aware it was so important.
I didn't. And obviously, for the listeners, adipose tissue is your fat tissue. And all, depending obviously how much fat tissue you have, you might actually be producing more, presumably.
Yeah. And they sort of think that's an important factor in the increased risk of breast cancer if your, adipose tissue is above the normal levels. So we've got that to contend with. And we now know that the gut microbiome is yet another hub of estrogen kind of activation. So you might be thinking, well, how can this be? So you're telling me that microbes in my gut can alter my estrogen levels. How does that work? Well, I've said that the body breaks estrogen down and it's done mainly in the liver, but certain gut bacteria contain the machinery to rebuild this estrogen, put it together again. And this newly put together estrogen is then recirculated in your blood circulation. And if you've got a potential estrogen positive receptor cancer, then that is a bad thing. You want low levels of estrogen, not high levels. So this whole idea of the Oestrobolome, this whole concept was introduced many years ago in 2011 in a kind of a key paper called Microbiome and Malignancy by two guys called Plottle and Blazer. Now, I'm just going to go off on a slight sidebar, just forgive me, Sheena, because this guy, Martin Blazer, you'll know because he's one of the godfathers of microbiome science. And he's the author of this brilliant book called Missing Microbes, which is right up your street, Sheena, because it's about the antibiotic overuse fueling allergies, autoimmune disease, and chronic diseases. But also, interestingly, he's married to another hugely influential microbiome scientist called Dr. Maria Gloria Dominguez Bella. So if he's the godfather, she is definitely the godmother. So she's this wonderful woman who, God, I would love her to come on our podcast, but she's kind of, too busy. She's professor of microbiome and health in America, and she really looks at microbiome science in this kind of multidisciplinary way. So she integrates microbiology and immunology and pediatrics and nutrition and anthropology. And she's done a lot of the studies that we've spoken about with cesarean sections and reseeding the microbiome after cesarean sections and lack of breastfeeding. So kind of really interesting. She's also interested in architecture and urban studies and where you live and what it does to your microbiomes. And also she's done this incredible thing where she's got this microbiota vault, which is a storage center. They're preserving human microbiota for future generations before it disappears, which is really interesting.
Wow.
So it's kind of, she's an amazing woman. And there's a film come out in 2022 called The Invisible Extinction, which focuses on the work of Blazer and Dominguez Bello, so this incredible couple, which I definitely think we need to look at, Sheena. And maybe we can invite listeners to view the film and, I don't know, hook up afterwards, do a podcast to discuss the film.
Brilliant.
But I think that'd be great. Anyway, I'm digressing, but he's incredible. And it's amazing that something that he was talking about in 2011 is still not mainstream. It just shows you how long it takes for things to get into conventional medicine and actually, change the way that we practice. So let's get back to the Oestrobolome and breast cancer. So we have these gut bacteria that contain enzymes called beta-glucuronidases, and these can reactivate, reconjugate this estrogen, return it to the circulation, and then it can move around the body and activate certain types of breast cancer. Now, for those of you who kind of think, well, what do you mean certain types of breast cancer? I'm sad to tell you that breast cancer is incredibly complex now. It's not just one diagnosis. There's many different subtypes. They all behave differently. They have different treatments. But about 70% of breast cancers are estrogen sensitive. So they respond and are fueled by estrogen. So that's why a lot of breast cancer therapy includes drugs that block either production or the action of estrogen. So that kind of makes sense if you're listening and wondering why we're talking about this. So you can see that anything the scientists come across that could increase or decrease estrogen levels is going to be really important to researchers. But as I said, you can't really expect your doctors and nurses to be discussing this anytime soon, because this is all still very much at the sort of the early stages. And it's not going to be in the NICE guidelines because it takes about 20 years for anything to get into the NICE guidelines. But I mean, there's a lot going on in research, but I know that Sheena, we talk a lot about, well, look, if it's not going to happen for many years, what can we tell people? What can we do now? How can we use the science that we have now to make differences for people now, rather than having to wait 20 years? And I think we can safely say with lifestyle medicine modalities, that's things like nutrition and good sleep and reduction in stress and physical activity and connectivity, all those things, that they can be used. We know they make a huge difference to the gut microbiome and moving it from a less healthy to a more healthy, types of bacteria and microbes. So, I mean, what are your thoughts, Sheena, about what we can do and what we can tell people now? What are you telling people in your surgery? Because you're kind of using this a lot already, I know.
Yeah, I am quite proactive on this. And actually, just because it's not in the NICE or the SIGN guidelines does not mean it's not evidence-based. And we see that in lifestyle medicine all the time. There's loads of lifestyle interventions that are hugely evidence-based. It's just that there isn't a guideline written for them, or rather, a lot of the guidelines that have been written aren't taking these lifestyle interventions into effect in their guideline. They're not being mentioned. And I think that's been a real limitation of modern medicine up to date. And it's difficult for me, I have to say, as a lifestyle medic these days. I find it quite frustrating when new guidelines come out and there isn't mention of lifestyle interventions and their impact, because I know that the impact of lifestyle is incredible on disease. So I am really proactive on this. I was actually really heartened to see a new guideline come out in July of this year, and it came out from the FLCCC, which is this is a alliance of basically global clinicians throughout the world who are actually producing evidence-based guidelines on a number of different health concerns. And there's an incredible webinar that they've produced called Cancer Care, the Role of Repurposed Drugs. And they produced a document on evidence base for repurposed drugs, so drugs that are used for other things that can be used to prevent and treat cancers, but also the evidence base for lifestyle interventions as well. And they've come up with a top 10 of these interventions that actually amount to much greater survival rates and prognostic, better prognostic signs in people with cancer. So it's quite an impressive document, and it mentions things like vitamin D, metformin. It even mentions statins and their anti-cancer effect, but also it mentions the impact of sleep and exercise and certain dietary interventions like intermittent fasting and low carbohydrate ketogenic diets for cancer. So that's really, really interesting to me to see a guideline being produced that is actually a little bit more pro lifestyle interventions. So yes, with that in mind, I am pretty pro-cancer, pro-treatment of cancer with other lifestyle interventions. And actually what I've started doing, Shiv, is if I see somebody with a new cancer diagnosis, I tend to call them up and we have a discussion about whether they're aware that their lifestyle is an important aspect of their recovery and their treatment, and I talk them through my area of interest, obviously the gut microbiome, and lifestyle medicine, and I talk them through the sort of research that I have done. And then I give them the option as to whether or not they're interested to take that conversation further and talk about making some change to their lifestyle. And actually, the vast majority of patients that I've spoken to are really interested in this. They're desperate to do something proactive now that they've got their cancer diagnosis, because they want good outcomes and they want to do anything they can to improve those outcomes. So I've actually been I've actually had very good experience in this area. So I obviously discussed diets, and we've talked about how important that is. We know the Western diet is so harmful to us and is associated with an increased likelihood of cancer. So we talk about a microbiome enhancing diet. I talk about intermittent fasting. I also talk about low carb, just because of the relationship between cancers and their desire to utilize glucose. And that's an important aspect of the cancer cell that's quite well recognized. Cancer is a very metabolic disease. It's really recognized as a metabolic disease now. So cancer cells utilize glucose as their main energy source, and diets that restrict sugars are actually more effective in helping reduce the cancer burden. So that's quite important. So we talk through things like that, and we talk. I'm particularly interested in expanding up the amount of plants in their diet to try to expand the microorganisms that are really beneficial to us. But also, I like to talk about the phytochemicals in plants as well, and how there are lots of anti-cancer phytochemicals in plants that we eat every day. For example, raw broccoli, cooked tomatoes are excellent sources of anti-cancer phytochemicals. And things like walnuts and stone fruits are very high in anti-cancer phytochemicals. And kiwi fruit has been found to be one of the most anti-cancer plants in the world. So there's lots of different plants you can utilize for their anti-cancer effects, and make sure you sort of weight them a little bit more heavily in your diet. So we talk about things like that. Obviously, that holistic approach is really, really important. So, it's important that they're sleeping well, they're exercising, they're managing their stress levels, they're getting lots of support, and they're coping with all the stress generally day to day of all the treatments. So that's another important thing. And then, of course, minimizing the harmful substances that they might be coming into contact with: alcohols, cigarettes, drugs, and any artificial additives that are put into our food system, like sweeteners and emulsifiers, are important to remove. Nitrites and sulfites and things like this that are commonly used in the processed food industry are all really sort of not very good for our gut microbiome. So these sort of things are I think really important, and I tend to sort of make regular appointments for these cancer patients so that we can sort of check in, because it's an awful lot of information to give over in the first time we talk about it. And so I tend to sort of have little conversations throughout their treatment about different aspects of their diet, and we try to enhance it as we go along. And of course, things will change depending on their side effects to their treatments, and we might have to change their diet accordingly. It's also worth mentioning that I try and encourage them to have some fermented foods in their diet as well, to encourage more of these friendly bacteria into their guts. But that's pretty much what I'm doing at the moment. Shiv, what about you? Are you getting involved with these patients?
Well, do you know what? It's just reflecting on what you're saying, because I've been a GP partner in 2 practices over the last 30 years, and I'm now back at university, as you know, doing a master's, and I'm actually doing a lot of sort of portfolio career, I guess, and I'm doing lots of locum GPs at the moment. And it's just really interesting hearing you talk, because that is what I used to do with patients, or that's the approach I would take for lots of, you would see someone and see them on a regular basis and help them through a difficult time. I'm just really concerned about this sort of fragmentation of healthcare and the sort of negative attitude towards a general practice, and just really forget how important this building a relationship with people is, that you can, see them on a regular basis. And I'm frustrated because I may be working as a locum in a surgery and someone comes in and they've just been diagnosed with cancer, and I just want to spend a lot of time with them and see them on a regular basis, and you just can't. And there isn't any place in the NHS that really does that. And it's a real worry. And I also sort of wonder about all these people who are sent for 2-week referrals because of suspected cancer. They just go and get a test done and are told yes or no, they have cancer or don't. But it's just such a teachable moment, and it would be such an interesting time to get people into a conversation about, okay, so I'm delighted to tell you don't have cancer. Isn't that fantastic? But let's now really use this moment to think about how we can massively reduce your chance of cancer going forward. And let's think about your health. It's just all these missed opportunities to prevent cancer. And there's a lot of emphasis on early diagnosis and incredible treatments, and that is fantastic, and that's what I want, but very, very little on prevention. So we kind of get very excited about, when people have cancer, but before that, it's really very odd that we don't put more energy into preventing it. And it's interesting what you're saying about the Western diet, because sorry, Sheena, you were saying about the Western diet and that it attracts or feeds bacteria that are less good for your health. And that's true with this Oestrobolome, because with Western diet, you get reduced beneficial bacteria, and you get increased potentially pathogenic bacteria. And they've got high levels of this enzyme called beta-glucuronidase, which is the one that transfers or reforms estrogen. So one of these bugs is strep pyogenes. So, that's just one example of what's happening.
Yeah. And I think also remembering that cancer is this metabolic disease, that, your heightened sugar exposure throughout your lifetime seems to increase your likelihood, in the same way that diabetics are more inclined to get cancers. We know now that this sort of metabolic dysfunction, where people are rocketing their sugars high and low throughout the day with this Western diet, is actually really pro-cancer. And so, when I see patients who are overweight, obese, patients who are carrying a lot of tummy fat in particular, it makes me concerned about their cancer risk, because I know that it's the same process that has made them gain weight that is likely to create these cancers. And so I think, we have to be really proactive when we see people who are overweight. We need to be proactive at looking at their diet then, and consider what we can do to help them to improve their health at that much earlier stage, before they get to the cancer forming time.
Yeah, I mean, absolutely. I think we've just got to stop thinking about things simplistically in silos of breast cancer over here and liver cancer over there. Our bodies don't work like that. And if you get cancer, people always want to know what was the one cause. And unfortunately, or fortunately, because there's a lot you can do about it, it's your body is a complex systems network. There's never just one thing that causes, one abnormality. When you've got this low-grade chronic inflammation, it's impacting multiple pathways, multiple molecular mechanisms. And if you've got a higher risk of, you're talking about metabolic syndrome and increased adiposity and increased inflammation, you're at higher risk of many things, including Alzheimer's, cancer, liver problems, diabetes, everything is connected. And the good thing about that may sound alarming to people listening, but the wonderful thing is that if we get to the root causes of these things, and if we sort of sort out gut health and increase activity and improve sleep and reduce stress, all those lifestyle modalities, they may seem like a lot to do, but actually they are wonderfully enjoyable things. They will make you feel fantastic, but they also massively reduce all these chronic diseases and cancer. So with one thing, lifestyle medicine, you're massively reducing your risk of all these chronic diseases. And I suppose what you're saying, Sheena, is we now see cancer as another chronic disease with, shared pathogenesis. So there's so much we can do. And I know you and I are really kind of buzzing with excitement about what could be done. And I think people are up for it. I think people are interested in their own molecular mechanisms. I mean, if it's presented in the right way.
Yeah, absolutely. So were you looking at some research this week, Siobhan? What have you looked at?
Yeah, no, I was looking. We did discuss, because anyone listening, when Sheena and I sort of plan these podcasts, kind of have to read for weeks, months even. We did discuss there was a brilliant paper on gut microbiome and prostate cancer, which I read, but each of these papers has loads of other references, which I started reading as well. And then it got all very complex and my little brain just couldn't cope. Because it's so interesting, but incredibly complex. They start going on about very intricate mechanisms. And so I picked out another paper, which I kind of loved when I first saw it. So I hope you don't mind, Sheena. This is one by Deborah Neiman et al. From the Weizmann Institute in Israel. They do a lot of brilliant work there. This is called the human tumor microbiome. It's composed of tumor type specific intracellular bacteria. It's published in Science in 2020. It's cited a lot in gut microbiome and cancer reviews and papers. It's a study where they did incredible work analysing the tumour microbiomes of 1,500 tumours across 7 different cancer types. So this included breast, lung, ovary, pancreas, melanoma, bone, brain tumours. So just to go back on what I've just said, yes, I'm saying that you have microbiomes in your tumours, in the cancer. And this is kind of pretty incredible. So when you're thinking about your body as an ecosystem and you're thinking about your gut microbiome as this incredible metropolis within your body, we actually now know that there's microbiomes in a lot of other places in the body, as well as outside on the skin and in the bladder and vagina. We now know that cancers themselves contain their own types of bacteria. So when they analysed it, they found there was bacteria in cancer tissues. Now, it's easy to think, well, okay, all cancers have bacteria. That's not true. So they didn't find it in all cancer tissues. And some cancer types have more bacteria than others. So, for example, just to give you a kind of ballpoint, malignant melanoma, about 14% of their samples, they found bacteria. There was much higher, over 60% in other cancer types. So that's breast cancer, bone, pancreas. And interestingly, because we've just been talking about breast cancer, they found the most rich and diverse bacterial types in breast cancer tissue. So, but we're talking tiny numbers. So when we're talking about the gut microbiome, it's just like ridiculous numbers of bacteria and microbes and trillions. And the numbers in cancers are very small, and that makes them quite difficult to detect. And also there was a lot of controversy about, well, could they just be contaminants? How do we know they come from? Because if you imagine you're getting a sample, then as you push the needle into a sample and remove it, there's lots of chances of getting contamination on your equipment. But they feel pretty sure, very sure in this case, and that they are actually within the tumour tissue. So these researchers found that certain bacteria seem to collect in particular cancers. So it's sort of beginning to say that each tumour type has a distinct microbiome composition. And interestingly, because I imagine these bacteria would be kind of floating around the cancer, the tumour lump, but actually most bacteria are actually inside the cancer cells. So actually inside the cancer cell or inside the immune cells which are surrounding the cancer cells, which I thought was interesting because it's not what I thought it would be. And they found that the bacteria in particular cancers correlate with the response to cancer treatment and also to other lifestyle modalities such as their patient smoking status as well. So they seem to think that they're not contaminants, but there's lots of questions they need to ask. So do bacteria seed early in cancer, or does the cancer grow and then the bacteria migrate from the gut and get into the cancer at later stages? And, why are these bacteria there? And also, is this just interesting, or is it really important to the potential mechanisms of cancer formation, and how do they survive and what do they feed on? And so it's this interesting, though, Sheena, because there's this idea that lots of our human tissue is sterile, but as technology advances, we seem to be finding more and more sort of microbiomes in different areas, and we're just getting the technology to actually try and detect these small numbers. So we could say, okay, this is interesting. How's it going to help us going forward? Well, kind of just getting a bit techie. So going forward, they're thinking these bacteria and other microbes may act as diagnostic tools. So you would, do a kind of barcode to screen for risk of cancer or the presence of cancer cells and how cancer subtypes and how they might respond better to one therapy or another. So you're kind of getting this idea of bacterial signatures on cancer that could sort of signal responses to treatment and also toxicity, that maybe this treatment will be less toxic for you than this one. And this whole idea of targeting bacteria, as a novel cancer treatment. But also, Sheena, we've got to remember that we're just at the sort of tip of the iceberg here, because we're just talking about bacteria, and we know there's going to be other microbes and fungi and, viruses. I mean, that's all to come, and it's going to get really, really complex when we start going into that. But what are your thoughts about that paper?
So it's really interesting, the signature of these microbiomes, these tumor microbiomes. And my understanding is that a lot of scientists believe they come from the gut. And I don't know what that paper was saying about that, but the type of microorganisms in, for example, pancreatic, the sort of typical pancreatic cancers, my understanding was that they are fairly classical of the more unhealthy bacteria that we see in the gut microbiota of people that are on, more high fat, sort of high sugar Western diets. Is that paper making any reference to that?
Yeah, they did that, and some other papers talking about the cancer disrupts molecular barriers, and also we've just spoken about the importance of the gut barrier and that it breaks down with dysbiosis when you have less favourable bacteria, and you get the seepage of bacteria or parts of bacteria like these LPS particles that then go into the body and trigger this immune response. And I'm guessing they could travel in the circulation or in immune cells, as we know happens with, during the perinatal period, that you get these bacteria that can travel actually in immune cells, which is pretty incredible. Of Uber their way to various places. But there's definitely, with low-grade inflammation, you get this breakdown of various, not just the gut barrier, but various other important barriers in the body. And these bacteria or bacteria fragments are able to pass through. So that does, and not just the gut. When we talk about the gut, we're often talking about the highest density area, which is the colon, but the gut is a long tube, and the oral microbiome is hugely important as well. So as you know, all these areas, I think we're going to find that a lot of it does come from the gut, because it is a very highly dense focus of potentially pathogenic bacteria. And another reason why, these patients, we want to get their gut health, and we want to move them from a dysbiotic gut composition to a really, moving all the time to a more beneficial composition. And that is something that we can do.
Yeah, because that's the really interesting thing, isn't it? Because we know that this Western diet is associated with these diseases, with these cancers. We know that high fat, high sugary diets with high carb, are associated with these tumors. We also know that they're associated with this type of these type of microorganisms within our gut, these more harmful microorganisms. And we know that it's associated with leaky gut. And then we see these same microorganisms in these tumors. And so it kind of makes sense that it's all tied in. But what's chicken and egg? What came first?
Yeah.
Was it the diet leading to the leaky gut, leading to the bacteria leaking out into the other organs and creating this inflammatory pro-cancerous response within these organs? Or, was there already a cancerous response in there that was some other mechanism? It's really, really fascinating to me. But so many of our tumors are so lifestyle related. And so it's, it's really, really interesting to see this relationship and to see the direct impact of these gut organisms within the actual cancers themselves.
Yeah, I mean, I suppose it's really an exciting opportunity as well, because actually, if we're saying that these is modifiable, I mean, that's very exciting. We're not just going, well, bad luck, there's nothing you can do. So at any stage in someone's cancer journey, whether they're trying to prevent cancer, whether they're, terrified because they've got a diagnosis, whether they're worried about the toxicity of treatment and whether it's going to work and their response, or whether the other side of it, they've had a good response and now they're feeling terrible and immune system's low and they want to get back and sort of start thriving and flourishing. I mean, all these lifestyle modalities, particularly diet for the gut microbiome, because we know that's the hugely influential thing on your gut microbiome composition. It's all available. It's incredibly safe. It's low cost. It's accessible to everyone. And we know it's a simple, safe opportunity to modulate your gut microbiome. And, there is no downside. And which actually, just Sheena, there was another paper I just wanted to mention because it really reminded me of what you were saying, what you discuss with your patients, which they're kind of incredibly lucky to have you. But there's a paper by Lee et al. It's actually, I think, Tim Spector from Zoe and the PREDICT trials was also involved in this as well. And I know there's been a couple of papers. This was called The Role of the Gut Microbiome for Cancer Patients Receiving Immunotherapy. And that was, it was published in the European Journal of Cancer 2020. There's also another one, which I'll put on the notes, on the show notes, which was advice to oncologists or what you should be thinking about telling your patients, because everyone's worried that this information isn't getting out there, and it's so simple and safe and effective.
Yeah.
And they discussed lots of things, but I thought what was interesting is the kind of, you can talk about the molecular biology, but our listeners and us, we want to know, okay, what can we do today for us, for our patients, that will make a difference? And the diet particularly can alter gut microbiome composition really quickly. So we know, not if you kind of have an extra kind of half an apple every now and then, but if you dramatically alter your diet for the better and include lots of fruit, veg, and a big diversity of plant-based foods, you can alter your gut microbiome in as little as 40 hours or at least 5 days. So this is incredibly quick. But they did say in this paper that because doctors, nurses, healthcare professionals were so limited on their ability to discuss diet, I mean, really is poor in medical schools still, that they were suggesting specialist dietitians with an interest in the gut microbiome. And I'm kind of thinking, well, where are they going to come from?
Where are they?
But, exactly, yeah. So they were talking about really simple things, though. So this was actually advising patients for immunotherapy, but it could be used for any cancer patients or just really sensible approach. So they talked about dietary fibre, and I go on and on about the recommended daily allowance in the UK is 30 grams a day, and we're woefully short. Let's forget about talking about protein. We're like 15 to 18 grams a day. I mean, this is, terrible. And low fibre diets, we're not getting these brilliant short-chain fatty acids, which do so much anti-cancer work. And if we don't have that dietary fibre, then our gut microbiota, the potential pathogens there are hunting around for other nutrients. And so you're going to get less favourable pathogens thriving and producing less favourable pro-cancer metabolites. And I know that the American Gut Project showed, I think it was over 30 different plants per week have produced the best and most diverse gut microbiomes, regardless of these people, regardless of their dairy, fish or meat intake. So it's really important to get those 30 different plants a week. Now, that includes, before you start getting really worried that you'll never have that, be able to get that in, that includes herbs and spices. And it really is quite easy to do. And, we can direct people. The other thing I was surprised about, they mentioned fermented foods, which is live microbes. And everyone gets a bit, I mean, it's incredibly safe, but everyone gets a bit kind of weird about live microbes and cancers, that they're going to do something terrible. And I'm sure that there are circumstances when people are immunosuppressed where you have to be careful. But on the whole, fermented foods are incredibly healthy. And we covered one of that important Sonnenberg study in a previous podcast, which you can go and listen to again. And things like natural yogurt have high Akkermansia, which is a really beneficial microbe, which is associated with reduced inflammatory markers and better lipid profiles, and small amounts of fermented foods and natural yogurts on a regular basis, low meat, low red meat, low processed meat, and get rid of the ultra-processed foods and additives and emulsifiers. Kind of really everything, Sheena, that you have discussed. So I just kind of thought I'd bring that up, because these are all things we can do now at no cost.
Absolutely. I mean, Akkermansia, I think, loves pomegranate, doesn't it? I mean, pomegranate and kiwi and stuff really encourage us at Akkermansia. So these are easy things to put in. And actually, because kiwi is so anti-cancer, I encourage my cancer patients to eat 1 or 2 of those a day. But there's so many things that we can do. And it's not, if you struggle with the diversity of foods, to get all of that diversity in, especially if, for example, you might also have issues with your gut, if you've had previous surgery and or if you have really bad irritable gut and you really struggle with fibers. Fasting is quite interesting, because fasting actually increases the diversity and richness of the microbes in your gut. And so that's another way of increasing that. And things like teas and coffees are very high in polyphenols, which again will feed these beneficial microorganisms. So there's other ways of getting lovely food for your microorganisms into your diet. And in addition, we didn't really talk about time in nature, but our organic gardeners out there actually have an incredibly diverse microbiome in their gut. And that's because they're coming into contact with so many microbes through the soil that they're in contact with. And that's another, really good thing a good way of expanding your gut microbiome. And if you're not a gardener, then just going out into the countryside and inhaling all those lovely microbes in the air, and coming into contact with the earth and with nature is actually a really beneficial thing for your microbiome. So that's another way you can expand it.
Yeah, so it's interesting what you said about Akkermansia, because that's one of the bacteria that really thrives when you fast, because it actually really likes eating the mucus layer in the gut. So when there's no dietary fiber there, you get a reduction in other microbes, and that actually blooms. So it's quite interesting when you're talking about the effects of fasting. You're getting these sort of increased levels of Akkermansia, which is a really sort of anti-inflammatory and beneficial on the whole. There'll always be different circumstances, but so it is really interesting.
It is. And Shiv, you mentioned dietitians there, and it is worth mentioning that currently the dietetic advice that people get in oncology is to have a high fat and high sugar diet. Because on the whole, the dietitians have been aiming for more calories and the quickest way of getting calories for people undergoing chemotherapy and things. And sadly, that kind of really goes against my messaging these days. And I'm struggling a bit with their messaging because I'm worried that the sorts of foods that they're recommending are, of course, these high fat, high sugar, very highly processed Western foods. Like the processed breads and the custards and the puddings and biscuits and cakes and these kind of things. And this is in their diet leaflets that they're handing out to patients still. And all of these things, of course, will drive up the population of harmful bacteria in our gut and will actually damage that population of beneficial microorganisms. So I'm concerned at the messaging that we're giving at the moment. And, it's one thing not keeping up to date with the research. It's another thing continuing to do something that's potentially harmful and in the face of emerging science. And, I'm concerned that our current practice now is actually so out of date that it's actually potentially harmful for our cancer patients.
Yeah, it's kind of really interesting. There's just been this tendency when someone's diagnosed with cancer to say, there's nothing you can do, the doctors will sort it out, just go home and be with your family, when there is so much that someone can do. And it'd be so empowering for patients to know that, spending time connecting with family and friends is hugely important for reducing stress, but also what they can do with their diet and physical activity. And there's so many brilliant things that they can do. And I think it would make people certainly feel better. It would really improve their, response to treatment and their immune system prior to having treatment. That's, I agree with you. I think we're getting to the stage where it's really unacceptable not to be telling people about these really simple, safe opportunities for them to really boost their responses. And I kind of think that takes us nicely on to our next episode, which for our third and final episode on the gut microbiome and cancer, we're really excited to be joined by the very brilliant Professor Robert Thomas, who's a cancer doctor at the Royal Marsden. And he's also a consultant oncologist at Cambridge University Hospital Trust, and he specialises in breast, bowel and prostate cancer. But he's an active researcher as well. And we're really excited because he's a professor of exercise and biological science, and he's a massive proponent of lifestyle medicine and how to integrate it into routine clinical practice, which is incredibly unusual. So we've got this brilliant professor who is lifestyle medic, and is interested in microbiomes and interested in integrating it into clinical practice. So he's also written a couple of books, Lifestyle Medicine. He edits patient cancer and lifestyle website called cancernet.co.uk. So this is going to be a really interesting podcast, Sheena. And I really want to ask him some of the questions that you've just brought up about, what are patients being told, and what is the dietetics input, and what can we do to help people get really good information.
I'm really looking forward to it. Wonderful. Thanks very much for listening, everybody. And we really look forward to the next episode. And we'll speak to you all then.
Thank you so much for listening to this episode of Microbiome Medics podcast. We really hope you enjoyed the content, and we welcome your feedback. We'd love to hear any suggestions you might have for microbiome topics that you'd like us to cover. And we also appreciate listeners' questions, and we'll endeavour to answer them in the next podcast.
So if you want to progress this learning further, look at the Gut Microbiome for Clinicians. It's an online course on bslm.org.uk, which will take you on a much deeper dive into the gut microbiome.